and participate via the chat feature. I'd like to extend a warm welcome to Dr. Kenneth Paul Rosenberg. We're so grateful he's able to join us today. He is the director, producer, and writer of Bedlam. A few words about Dr. Rosenberg. A medical student at the Albert Einstein College of Medicine in New York. He also studied film at NYU. He co-produced and co-directed An Alzheimer's Story, a film about living with Alzheimer's disease, filmed over the course of 18 months. After his residency in psychiatry at the Payne Whitney Clinic at New York Presbyterian, he did a fellowship in public health, during which he directed and produced Through Madness, a film on serious mental illness for PBS. While a practicing psychiatrist, Ken produced and directed films for HBO, including Why Am I Gay? Stories of Coming Out in America, Back from Madness, and Drinking Apart. He also executive produced Cancer, Evolution to Revolution, which was a Peabody Award winner. Dr. Rosenberg is also the editor of medical textbooks and author of popular books, including Bedlam. Thank you for joining us this evening.
Thank you so much. Can everyone hear me? Yes, fantastic. It's really an honor to be here at a place that kind of embodies a clubhouse model. So I'm very grateful to Primetime House and the Torrington Library. Very grateful to Jennifer Hale and Dr. Andrew Gerber, who will be joining me in a few minutes. And I'm going to read a little bit from the book, Bedlam, just really literally from the first chapter. Talk more about why I did the film, why I wrote the book, and we'll show a clip right after I read from the book. We'll show a clip from Bedlam, the trailer. And Bedlam is very easy to find. You can find it at pbs.org and watch it for free, which is really why we made the film, that people watch it for free. And fortunately, millions of people have watched it for free. So I'm very grateful for that. And thanks to the MacArthur Foundation and PBS, we were able to do just that. Well, let me read a little bit from the book. If you've seen the film, or if you will see the film, you know it's a very, very personal film. It talks about not just the patients who I followed for several years in Los Angeles, but it talks about my family, my sister. And I have to tell you, when I made this film, I expected I would film the emergency room for just a few months maybe, and that would be that. It was going to be a film for HBO about life in the emergency room, but I realized very, very quickly that really didn't really capture what it was like to live with the most serious, and I say the most serious mental illnesses. So I decided that it really would be a film not so much for PBS, but more for HBO, not so much for HBO, but more for PBS, that would really follow people's lives over the course of several years. And then I realized when I was editing it, and I went to a little barn somewhere in Massachusetts to edit this film, I realized that what was missing was my story. And so in the film and then in the book, I decided I would write more about my story, and my story being the story of my family. So let me read, with your kind permission, from chapter 1. And I'll just read a little bit and then we'll watch the trailer and then we'll have our panel discussion. Chapter 1, How It All Began, from Bedlam. It had been 2 weeks since I'd spoken to Merrill, and I was afraid. For months, I'd been calling my sister every few days, cajoling, threatening, using every carrot and stick that I could to convince her to move to a facility that would care for her and where she might make friends for the first time in decades. Finally, she'd stopped answering the phone. Now 55 years old, she had been living on her own for the first time since my mother died two years earlier. On December 27, 2005, after 14 days of silence, I rode the Metro North train home from work in my Manhattan office, focused on the task ahead. As an addiction psychiatrist, I had spent the day treating people with depression, anxiety, and drug and alcohol problems. Over the years, I've received many notes of thanks from patients for saving their lives from their various addictions, but it had been years since I treated someone with schizophrenia. I lived a comfortable life, commuting between my Upper East Side office and a bedroom community in Scarsdale. The loving and stable home I'd created with my wife and our 2 children offered a complete departure from my chaotic childhood in Philadelphia. Now, the chaos was creeping back in. Despite all my psychiatric training and practice, I was at a loss for what to do about my sister. As the only other surviving member of our family, I was the last person left to care for her. Cancer had taken my father first, and later my eldest sister, Gail. Finally, my mother's passing left me in charge. I had been determined to find a reasonable plan for Meryl's well-being and had made arrangements with a convalescent home that could offer her a life free from the years of hoarding that had turned the house where we grew up into a hovel. But the longer my calls went answered, the clearer it became that I would have to betray my mother's dying wish that I never, ever call the police on my sister. It was not unusual for Meryl to avoid me. In the 2 years since my mother's death, I had often called the emergency operator. Bear in mind, this is 2005 when we had emergency operators. I had often called the emergency operator who would report that the phone was off the hook. Call the police, they would suggest. No police, I thought. My sister would call me when she was ready. But this time was different. The phone was on the receiver. In a last-ditch effort to avoid the unavoidable, I reached out to Gail's widower, my sister's widower, my brother-in-law Bob, who lived nearby, to ask him to knock on the door. No answer. Mail was piled up on the doorstep. It was time to make the call. So with that, I talk about the call to the police, and that's what starts my book and starts the story of Bedlam in the Penguin Random House book. But now I would like to show you a few minutes, actually a minute and a half. That's a trailer from the PBS film Bedlam, and then we could come back and answer your questions. Thanks.
Excuse me, Christy, you need to unmute yourself. We can't hear the video.
Sorry about that. I will restart it.
Very busy day.
Mental illness is not something people want to hear. It's not something they want to talk about.
I'm calling from LAC USC. I was calling because we have a patient here. She's here in our psych ER.
The state of mental illness in this country is beyond the trite notion of crisis. It's at a point of comedic absurdity. The number of people that we just completely given up on is just staggering.
A lot of people around here suffer from mental health issues, and that's why they're down here. I suffer from it, and these people suffer from it, and there ain't no help nowhere. It's just sad.
We have historically not fought for people with mental illness. And people are rising up and saying, we are sick and tired of our families being thrown away.
No justice!
As long as doctors tolerate these working conditions and the outside world won't know what's going on, then nothing will ever get better. The definition of insanity is repeating the same thing over and over and expecting different results. The way we treat mentally ill in this country is insane.
I'm afraid that's the system.
Thank you. Very powerful. If you haven't had a chance yet to watch the film, we were showing it over the weekend through the library. It is available through the month of October on PBS. So I'd recommend that if you haven't seen it, you watch the full movie. Also, the book will be available as part of the library's collection. So I just wanted to thank Dr. Rosenberg again for being here, and I want to introduce our other panelists. Dr. Gerber is president and medical director of Silver Hill Hospital, a private nonprofit psychiatric hospital in New Canaan, Connecticut. He is a child and adolescent psychiatrist whose career combines his work as a clinician, scholar, research scientist, and executive. Dr. Gerber completed his medical and psychiatric training at Harvard Medical School, Cambridge Hospital, and Weill Cornell and Columbia Medical Schools. He completed his PhD in psychology at University College London and the Anna Freud Center. Prior to joining Silver Hill, Dr. Gerber was director of the MRI program at the New York State Psychiatric Institute, Columbia Medical Center, and medical director and CEO of the Austin Riggs Center in Stockbridge, Mass. Among his many affiliations, he serves as associate clinical professor at both Columbia University Medical Center and Yale University. Welcome, Dr. Gerber. I'd also like to welcome Jennifer Hale. Jennifer lives in Winsted, Connecticut with her husband, Christopher, and 4 children, Mackenzie, Ryan, Kevin, and Matthew, who are 11, 10, 9, and 6. She's been a member of Primetime House since 1992 and is dedicated and passionate about advocating for better mental health and addiction services for the community. Jennifer has been part of the Catchment Area Council number 22 for 20 years and currently serves as its chair. She also chairs the consumer action group known as the Conscious of the Mental Health and Addiction Community. Jennifer is involved with the Advocacy Action Board, Keep the Promise Coalition, National Association of Anorexia Nervosa, Connecticut Families for Effective Autism, Children's Mental Health Network, National Federation of Families for Children's Mental Health, Autism Speaks, and CHADD, a national nonprofit that improves the lives of those living with ADHD. In her spare time, she's testified on both the state and federal level to ensure that no child or adult endures neglect or pain in the mental health system. She wants all that struggles with mental health to receive community and inpatient services without abuse that help them live the best life they were meant to live. So I want to extend a warm welcome to both Jennifer and Dr. Gerber. Thank you both for being with us.
Thank you.
Dr. Rosenberg, you know, your story shares, as you say, not only America's tragedy, but also your own family's personal tragedy. How did you come about deciding to share your sister's story as part of this?
Oh yeah, very good question, very important question. As I said earlier, originally I thought, you know, like I every 5 to 10 years I make a film. It had been for HBO. I actually started out with PBS and HBO. I originally thought that I'd make just, you know, a film where I spend a couple of months somewhere and then we spend a year or so editing it and then we come up with a film. But as I said, I realized early on that that's not the way to tell the story of an illness, you know, as profound, as serious and severe mental illness and persistent serious mental illness. So I decided to stay there for a long time. But then when I was editing the film, I realized that, you know, not that it was dishonest, but it didn't, you know, the more you could kind of get into the truth of the situation, the truth of the story, the better you can be as a filmmaker or as a psychiatrist or in anything we do, right? And I certainly realized that what was missing and what I had not spoken about almost to anyone was the real story about my sister's illness, the shame that my family had, how they hid her illness, how she had this, you know, tragic experience of jumping from our 3rd-story window, her bedroom window, onto a concrete driveway and breaking nearly every bone in her body, but surviving and still my family persisting in their denial. Now, for me, that was a very profound experience, right? I mean, of course, it's profound for everyone. No one more than my dear sister. But for me, it's what made me become a psychiatrist. When I studied film while I was a psychiatrist, my first film was about schizophrenia. It was always with me, but I never really shared that story. And I realized in editing this film that, you know, it was the missing piece. Why was I doing this? Why, well, you know, I could get away with the fact that I was a filmmaker and it's an interesting story. I could certainly, you know, get away with the fact that I'm a psychiatrist. So therefore I should be interested in people with serious mental illness. But I thought that, you know, that the whole purpose of the film was that we have to talk about our experiences and that we have to share our experiences. You know, we talked about destigmatization. We talk a lot about trying to end the discrimination that plagues not only people with serious mental illness, but all people with mental illness, and also people who are professionals for those who treat mental illness, the discrimination that plagues us all. And, you know, you can't, James Baldwin said it kind of beautifully and eloquently that, you know, you can't change everything you seek to change, but you certainly can't change anything unless you confront it and talk about it and deal with it. So it was kind of in that spirit to make a better film, I guess, to kind of be a better person, to do a better thing, that I decided, you know, that I would share my story. It had been so much so that in my book, if you read the book, that at one point there's a wonderful, brilliant, important therapist and psychiatrist named Lisa Dixon, who's a leader now in the field of mental health and serious mental illness research. And Lisa and I did our residency together. And when I came to my residency, she somehow found out, because I had told one person way back when that my sister has serious mental illness. And Lisa, when we were residents, walked into my office and said, "Ken, we have something in common. We both have siblings with, you know, schizophrenia." And I was like, I didn't talk to her for like 10 years. Seriously. I was like, I didn't know what to say. I was so, you know, despite the fact that I was a psychiatrist, I was so kind of quiet and silent. And I guess I have to say, ashamed of dealing with that and ashamed of dealing with my family's shame that I hadn't spoken about. So I think that for me, it's a long-winded answer, but I think that for me, this was a very, very important thing to do personally, but also in the spirit of the film, the spirit of ending stigma and ending discrimination, because we cower in the corners and, you know, don't demand the action that I think we should demand from insurance companies, from medical professionals, you know, so forth.
Yeah, thank you. I think it was a very valuable part of both the book and the film, and I agree. It's only by sharing our stories of our own families that we can break down stigma. Dr. Gerber, as a psychiatrist, what is your reaction to the film? What has been the reaction of other professionals in the field?
Thanks, Christina, and thanks for having me here, and particularly thank you to Dr. Rosenberg for writing that book and making such an extraordinary film. So I have a reaction which may surprise people, which is I so deeply resonate with the experience and the depiction he has of psychiatry, and I say to myself, why isn't this more widespread? Why aren't we talking about this as psychiatrists, as psychologists, as mental health professionals? Why are so many of the books that I read about mental health stories of the extraordinary accomplishments, a new medicine that came out or a new therapy, rather than talking about the reality of how we treat serious mental illness in this country? And I think that in parallel with the kinds of shame that Dr. Rosenberg talks about in people's families is kind of a secrecy in the field. And it's strange, because it's not that anybody ever stopped me when I was training as a psychiatrist and said, don't talk about what goes on. But rather there was almost this kind of understanding that the system was broken and that you did the best you could while you were in it. And that's so beautifully, I think, depicted in the film. But then if you were, and this is kind of a very sad truth, if you were quote unquote successful, you left your training and you treated more mildly ill individuals. the most quote unquote successful graduates of top residency programs, top psychology programs, top social work programs would have practices in which he treated individuals who didn't need to go to the hospital, who didn't have schizophrenia, who didn't have treatment refractory bipolar disorder, or even if they were unlucky enough to have needed a hospitalization, it was quick. It was a day or two, and then they got back to their lives. Whereas the reality, as so well depicted in this film, is much uglier than that. And in this time of extraordinary accomplishment in the world of biomedical sciences, when we're figuring out how to sequence genes and solving complex problems in almost every field, to acknowledge how little progress we've actually made in the treatment of persistent mental illness, and frankly, rather little resources that we've put into it, at least on a global scale, as compared, for example, to how much we put into the jail system or into other forms of controlling some of these behaviors, is frankly, I would say, embarrassing to our society. So to me, watching this film felt like this relief. It felt like this is the truth that I've known for many years. And frankly, it's the truth that my patients and their families have known for many years. And this is a vehicle to actually having this conversation in a much broader forum. So I'm hopeful that this conversation really can make a big difference on how we think about this.
Yeah, well said. I think that was what struck me too, was how far we have not come, in terms of what we do for research for other diseases. And Dr. Rosenberg did a good job of highlighting that we haven't made much progress at all. So thank you for pointing that out. Jennifer, you have your own powerful story of living with mental illness. Can you share some of your experiences and how they relate to your reaction of the film?
When I watched the film, because I hadn't heard of the film, and then when Zach asked if I would be on the panel, I immediately went and watched the film, and it brought up when I was first hospitalized when I was 20 years old. And when I turned 21, I was admitted into Fairfield Hills, and that was I would say one of the worst experiences in my life. That was a state institution. And at that hospital, there was a lot of abuse, physical, verbal, sexual, just a lot of abuse that I kind of like put in the back until it's come up a lot recently, especially with a lot of stuff that had happened with the stuff that came out at Fairfield Hills in the news and stuff. But just watching this film, it brought up a lot of stuff. But it reminded me of being there. I was constantly told, this is going to be your life. You're never going to get out of here. You want to have a family, forget about that. You want to have a job, you're never going to have a job. This is going to be it. I remember being over medicated to the point where I couldn't even walk around. My family constantly reminds me that when I was released, that I was like zombie-like. And I was at the point where I thought that was supposed to be my life, because I was constantly told that over and over. I think it was when I was introduced to Primetime House where they actually gave me hope. And it was where I actually was able to realize that, having a mental illness, that doesn't define you. And yeah, even though I've had a lot of hospitalizations since then, because that was like back in 1990, I can tell you that the hospitals that I've been in, and I've been in a lot, they need to change. And I think the Consumer Action Group, we put forward a hospital proposal, and it has a lot of consumer voices on that. And but there has been some progress through the years, but there's a lot of progress that needs to be made. I think with hospitals bringing forth peer support specialists and the communities having programs like Primetime House, I think that is what makes people's recovery a lot better, because I was able to become a CNA. I was given hope. I was able to get a job. I never thought I was going to have a family. I have a great family. I didn't think I would be where I am. I think that's what the communities need, is a lot more community programs like Primetime House. And I think the government needs to put more money into programs like this. But I think people also need to realize going into the hospital isn't a bad thing when you need to go into the hospital. But I don't think long-term institutionalization or putting people into prisons that have mental illness when they commit small crimes, I don't think that's the answer either. I think there needs to be better things that need to be done.
Thank you, Jennifer. Thank you for being so brave and sharing your stories. And you said you hope that your mental illness does not define you, and I can assure you it doesn't. You're defined as your role as advocate and mother, wife, CNA, and we're grateful that you're part of Primetime. One of the things you do talk about, though, is the abuse you suffered at the hands of a state psychiatric hospital. And Dr. Rosenberg, some questions that we received prior to airing the film was that, does this film promote the return of large psychiatric hospitals or even institutions? How do you address that?
Yeah, I want to talk about that, but I also just want to say that, I'm really just privileged to be with you, Jennifer, and also you, Dr. Gerber. I mean, really what they say resonates so with me, and we could pick up on some of their themes about how psychiatrists responded, which has been shockingly positive. I mean, the American Psychiatric Association has embraced this film. The Department of Mental Health, where we filmed this in Los Angeles, has embraced it, and it's really just so we can have conversations and people could speak as Jennifer just so beautifully did. So yeah, just very moving to be part of this. Do I want to bring back the dreadful asylums of the 1950s? God, no. I mean, look, we have 2 to 3% of the state psychiatric beds that we had in the 1950s. And mental illness has not exactly gone away. So we need some kind of inpatient care, but I think as Jennifer expressed, that should be compassionate, humanistic, thoughtful inpatient care. It shouldn't be, these horrible asylums that good riddance to them. They should have been destroyed, but we should have built something in their place. And that, as you know from the book and film, that is the fundamental problem. We had a wonderful idea from a wonderful president, in my estimation, JFK, to build community mental health centers to replace that. But they weren't, they weren't like Primetime House. They were places that were to kind of prevent mental illness in a way that we couldn't prevent it. It was based on several faulty assumptions. One, that the new medicines that were developed in the 40s and 50s would eradicate serious mental illness, and that what we need to do is prevent serious mental illness. That was a faulty assumption. It was, not partially, they were never built to the extent they should have been built, and they weren't funded. And by the 1980s, with a new administration, the funding was completely dried out. So we didn't really de-institutionalize, right? We didn't go from get people out of institutions. We trans-institutionalized. We sent people from the dreadful asylums to, in my estimation, the worst streets and the far worse prisons. So right now, if you have a mental illness, you're about 10 times more likely to be living in a jail or a prison than you are to be living in a hospital. I don't think we should bring back the asylums, but I think we should bring back more residential care. And I certainly think we should develop, as you all are doing so clearly, community mental health models that are viable. You know, it's being done around the world. Fountain House, where I spoke about this, is doing a magnificent job. There's a wonderful place in Trieste, Italy, that's a World Health Organization exemplar of community mental health. So I think that we need those kinds of cares. But, you know, I mean, you know, there are some good hospitals. I think that, you know, we have more than one good hospital in Connecticut, unfortunately, you know, Silver Hill being among them, right? But where the place that you experience, I mean, that brought tears to my eyes, Jennifer, when you were talking about that. And, you know, those abuses of the past, good riddance. Those places should be destroyed, and they were a scandal. And we still have many scandalous places. I also want to say a word about treatment, because, you know, it's not that we don't have good treatments, it's that they're really insufficient. And I think that the illnesses are really challenging. And we need better treatments. We need both better medical treatments and better psychological treatments, and we need a use of peer counseling and peer supervision that is all but absent. You know, when you go to the emergency room, you see the police, you see the sheriffs, you see some doctors. You don't see a whole lot of peer specialists saying, it's going to be okay. I've been there, done that, you know, I got your back. And I think we need more of that. So I think we have treatments, even for the most serious illnesses. Those treatments save lives, but they're, as we could talk about later, they're insufficient. But once again, I can't say enough. I don't think we should bring back the asylums. First of all, I don't think we should bring back the asylums of yesteryear, because we don't have the diseases of yesteryear. It's really changed. It's much more complicated. It's much more embedded with social ills and poverty and substance abuse. So I think we need new programs, but I think we do need some residential treatment. And I think we need a whole lot more community health treatment.
Dr. Gerber, from your perspective, running a hospital, how would you address that?
So I think Dr. Rosenberg's exactly right. What we have learned over the decades, and we have learned some things, is that we need a range of options, that there is no one size fits all, whether it's medications or institutions or even residential hospitals. They're not the solution for everybody. What we need is a true continuum, and we need the ability to move flexibly between them. Obviously, we all want to be in as least restrictive a setting as possible. So if we can live independently, or if we can live with family, that's ideal. But in serious mental illness in particular, there are times when, to be safe and to be stabilized, one needs to move up to a more supportive environment, such as a residential, or even at times to a more supportive environment like an inpatient facility. But the answer isn't just to stay there. The answer is to be able to flexibly move to the level of care that's best for you at that particular time. I mean, the piece that I struggle so much with is that, you know, there are a lot of good minds, right? Even you know, Dr. Rosenberg and Jennifer and others have a lot of great ideas about how to care for individuals. One of the big questions is, how do we build it in our current contemporary society? And the truth is, whether we like it or not, we live in a capitalist society where financial incentives control an enormous amount of what happens. And without, you know, wanting to sound too much like a conspiracy theorist, I think one has to confront the fact that two of the strongest financial forces in mental health care for many decades has been the insurance industry on the one hand and the pharmaceutical industry on the other. And that doesn't mean I'm against medications. They're extremely helpful. And it doesn't mean I'm against, you know, insurance. That's also very helpful. But if those are the only forces that dictate treatment on the care, you can imagine how that skews the whole field. And I think in order for us to treat people appropriately, there have to be other forces. The professionals, the policymakers, the citizens, the people with family members and those who are affected themselves have to be able to stand up and say, those are pieces of the solution, but we need to design a larger system. Some of our best treatments, whether they be various kinds of psychotherapy or even older medications that no longer make a lot of money for the pharmaceutical companies that originally produced them, have no advocates for them because they're not directly tied to a financial incentive, and that's a real problem. So we need to build systems with this in mind, and not abdicate our responsibility and let private industry, or let the insurance companies, and let the pharmaceutical industry make the decisions that we need to make for our society. And that's hard to do. That takes getting together and really building a kind of grassroots movement around this, and working from all disciplines. So to me, a conversation like this, a movie and a book like Dr. Rosenberg has written, is a chance to catalyze our energies and to really bring us together.
Just want to remind participants, feel free to put questions in the chat, and we'll get to as many as we can before we end this at 8 p.m. Dr. Rosenberg, in your answer, you talked about, community systems of support. Certainly, Primetime House being a Clubhouse International program has helped members like Jennifer. She spoke about how, with our support, she was able to get a job and go back to school. And are there other models that you recommend that the system look at to counteract this crisis we're in?
Yes, well, yes, like from at every step. The first, when we're talking about serious mental illness, the first people you call is one of the few medical, if not the only medical emergency, that you call the police. And so that's where a lot of trouble begins. The police, I am a big fan of the police. I think they do a very good job, but I think when they have a tough job, but when it comes to mental illness, they're not trained to do that. It's like, many people have said it's like closing all the child care centers and replacing them with plumbers. They might be very reasonable child care workers, but plumbers are not child care workers. Police are not mental health professionals. So I think so that's the first step. And as a consequence of that, of the police being the first responders, 25% of fatal police shootings involve a person with a mental illness. And of course, when you multiply that if it's a person of color, it's much more likely. So I think the first responder situation has to be changed, and it is changing. So the police have to be trained. The police work best when they're with a person with a mental illness, when they're not acting like police, when they're not wearing uniforms, when they're not trying to intimidate, when they're not using tasers. Sometimes it's necessary, of course, but the idea of trying to dominate someone who lacks judgment is a very fraught idea, obviously. So there's crisis intervention training, and there's retraining the police, and there's trying to replace 911 with 311, and there's lots of efforts around. In New York City, there's a large effort, rather controversial, but a large and I think well-meaning effort on the mayor's part to educate everyone about mental illness, so people could understand what they're dealing with and how to respond. So there's the first responder place. Then there's what happens when people are taken somewhere. Well, often they're taken to an emergency room. Sometimes they're taken to a jail. The police have to decide between taking them to an emergency room or a jail. Now, if they take them to a jail, they're going to kind of just drop them off at central booking. They're going to be done with them because, as it's said, the jail bed is the bed that never says no. If they take them to an emergency room, the police are going to have to make a decision that the person, this is worth their time. They're going to 3 hours there. 10 to 20% of police transport time is schlepping people, to use a professional word, schlepping people with mental illness back and forth to the emergency rooms. So there's that, where do they go? And in Los Angeles and other places, they're trying to develop alternatives. And then there's a big question of kind of, treatment and how people should be treated once they are treated, as Dr. Gerber was saying, for the acute illness, whether it's in a hospital, an emergency room, some kind of residential care. Clubhouse models, of course, have been with us for a long time. They are vastly underutilized, probably largely for the reasons that Dr. Gerber explicitly talks about. There's not a financial incentive. There's not a big clubhouse industry where people are, and there should be, because it's probably the most important and humane approach out there. There should be community mental health workers, as there are in many places. I mentioned Trieste, which is a World Health Organization exemplar of mental health delivery care in the community, where people are constantly 24/7 available. It's a very different place, very different demographics, very different social problems, but still, given the fact that they're so embedded in the community, so available constantly, they have very little use for a hospital, and they have no use for the police when it comes to mental health crises. So I think there are many ways. So models for treatment are I think community-based models, like the one like Primetime House, and other ways of there's also other things for people who can't get to someplace like Primetime House, or who maybe don't know they're sick. I mean, there's other wraparound services. There's leverage treatments, which are controversial, but there's assisted outpatient treatment, which is kind of providing wraparound services for people. It often involves a judge, but in the best of situations, it involves a benign judge and a benign system, which is designed not to penalize, not to punish, not to institutionalize, but to really open the door. Because once you're in a mental health court or an assisted outpatient court, there are ways there that people could be kind of let in to care that's otherwise closed. We saw in the film, for instance, Monty went to a mental health court, and the judge wisely diverted him from going to prison, where he could have been a third striker and been there for years for a felony offense, which was simply breaking a window, an offense of over $400. The judge diverted him from prison into treatment, but there wasn't the treatment available, so Monty had to wait for 3 months, 4 months to get into a treatment center. We saw that in the film and the book. So I think there are, wraparound treatments like assisted outpatient treatment and mental health courts are also a very, very good system. There are good systems out there, and I think there are good people out there. Everyone blames this one or that one. I think, we're just not really making this a priority. I think that's the blame. That's the problem. That we have very good solutions. We have very, very good models, and we need more research, and we need more care, and we need more attention. And in some, I think that would happen if we made it a priority, because as a nation, we're not exactly making this social crisis a priority.
Well said. Thank you. Personally, I watched the film with my husband, who's a first responder in Waterbury. He's a firefighter EMT. And he said just what you said. He was watching the film and he says, I've been in a house like that. I've treated an individual like that and like that. And he says, and we're not trained. We're trained to save lives, but not in mental health. So I fully agree with you. I'm going to try to get to some questions now from the group. Sherry's asking about housing. You highlight the plight of the homeless. She's saying housing can be a huge issue. Many people need subsidies available to them, but often then the outcome is that they are moved into elderly housing. And then there is stigma from their own housing communities and their neighbors. And that's something we face here with our Primetime House members. What models in your experience have you seen them work better than putting them individuals into homes with the elderly?
Yeah, certainly putting people in homes with elderly is not a very wise idea. I think that the Fountain House model is a very, very good one, right? Of people living in the community with other people who have mental illness. My sister, unfortunately, couldn't do that sort of thing because she couldn't admit, or could my parents, that she had a mental illness at all. But I think that, Fountain House is a very good model for that, of, people living in the community, not in the wrong place, on the right place. And by the way, people end up with the elderly because, we don't have enough places like that. When I had to look for a place for my sister, the only place I could find that would accept her was a convalescent home. That would have been the wrong place, but it would have been, better. I mean, there's also, many models that need to be revamped in California. I'm a New Yorker, but I know a lot about California because I spent a lot of time there for this project. They have board and cares, some of which are wonderful, some of which are really quite hard. So I think that we need more attention to that. And as I keep on saying again and again, I think that there are models out there we just have not made a priority.
Sorry, I was muted. Another question from Deborah. I'm a middle school teacher in Waterbury, and I applaud you for this film. It touched upon so many aspects of mental illness. For me as a mom, my children's uncle was schizophrenic and committed suicide, so there was always hush hush about that. And as an educator, have you approached schools at all in any form? Mental illness is definitely a looming issue. We are fortunate in our school to have a community-based clinic right in school that offers counseling to families. What can she do in her position as an educator in an inner city school system?
Well, I think it's a great question. The first thing she could do is, even though it's very hard, is to talk about her experience with her uncle and how that was hushed up. Because I think that's exactly what I try to do in talking about my sister. Yes, we have gone out to schools. PBS has a model for schools. Random House also has a model for schools. We have a very extensive and I think wonderful study guide that goes out to folks. And we're fortunate because PBS has a far reach, and we're part of a stream called Independent Lens, which is the most popular stream for documentaries on PBS. And we were, I'm happy to say, their most popular show of the year, which is interesting. I mean, I think that people are trying to understand this. We also, I often say I was shocked we got into the Sundance Film Festival. I was more shocked that we're the first film we ever had on serious mental illness. So I think that high schools are now showing this. We are trying to get in there. I think that there's you could go to bedlamfilm.com and figure out ways to get to this community. We try to do it as cheaply and as efficiently as possible. We actually prefer to do this, to make it available for free if we possibly can.
If I could just jump in there, I'm trained as a child and adolescent psychiatrist. And one of the things I frequently have heard from parents, from schools, from otherwise well-informed individuals is, should I not talk about these things because it'll give people ideas? It'll give kids ideas. Should we not ask, for example, in schools about depression or anxiety or suicidal thoughts because it'll put the idea into a child's head? And in fact, the evidence is overwhelming that that's the opposite of the truth. That when you ask these questions with children appropriately, obviously you don't do it in a way that overwhelms them. You make it possible for them to ask for help. You don't give the idea to anybody who didn't already have it. We know that the rates of depression, anxiety, and even suicidal ideation in high schools and even down into middle school are significant. And if we don't create an environment where people can talk about this and feel safe to talk about it, it's just going to get worse. So bringing it into the schools is essential. But let me just say one other thing, because the way in which the incentives can be perverse. I've heard it said by school officials, we don't want to ask these questions or have any formal, because if word gets out that we have these issues in our school, it will make our school look worse. And even if we got funding to help it, well, then our school would become a place that people think there are more kids with mental illness. So there are all these kind of perverse reasons why people don't want to talk about it, why people hide it and think that, well, nobody else is talking about it, so I better not talk about it either. And the only way around that is to do it together and to show that it's not true of one town or another. It's not more true in Bridgeport than it is in New Canaan. It's true in every community that mental illness is there, and we have to find a way to get that out there.
I am very open with my kids, and my daughter on World Mental Health Day, she even asked the principal if they could have a moment of silence for all the people that are suffering with mental health issues and stuff. So, and she's only 11, so she's pretty grown up for her age and stuff. So, but because of the stuff that I've gone through, and so I'm pretty open and stuff. In our school system in Winston, they have a community health center within the schools, so we're very fortunate there. So
thank you, Jennifer, for sharing. You've obviously done a good job with your children, teaching them to talk about these things. We're getting short on time. I'd like to, if each of you can quickly, what do you hope audiences can take away from this film? If there's one key thing that you hope we can take away and maybe set as an action item, a call to action, if you will. Dr. Green?
Yeah, I'll go first. I mean, I actually just in the chat, someone mentioned Daniel Prude, so I won't want to, lose an opportunity to talk about that. That was an incredible tragedy that most of you know in Rochester, I believe it was. Daniel Prude is a great podcast on the Daily, New York Times puts out, that really kind of went into depth about the Daniel Prude tragedy. That's an example of how a man with serious mental illness was treated and mistreated by, I'm sure, well-intended police who ended up killing him, basically. And that's, as I say, 25% of fatal police events, outcomes have to do with a person with serious mental illness. So what would I like from this film? I mean, certainly, God, I would like to prevent those terrible tragedies, that happen to Daniel Prude, that happen every day, that have made, that happen to all of us, whether we're family members or patients. 50% of us at least need psychiatric services at some point in our lives. This doesn't, this affects everyone. So I hope that, truly hope that lives could be saved by talking about it. And I believe that's the case. We see that in other diseases, right? We see that in HIV, where people acted up and, literally there was a movement called ACT UP that changed the course of HIV. We see that in cancer, and breast cancer in particular, where a lot of very angry people have changed the course of that disease. So it's now still a difficult disease, but not anything like it was 30 years ago. So I think that we need to, and we document that in the film, and we've been part of that. Actually, we're part of a political referendum that one of these things that I'm going to be doing in 2 hours from now in California about there's a measure on the ballot to try to help decriminalize people with serious mental illness. So I think that there's many things you could do, but I will say I think the most important thing you could do, and what I've advocated over and over again, is to tell your story. And we all have a story to tell. If it's not ours, it's our sisters or our parents or our children's. And I think that, as we say over and over again in the film and the book, shame kills. Shame is a real obstacle to getting help. So I would say if there's one action item, it's to tell your story.
Just to follow up on that before I go to Jennifer and Dr. Gerber for their closing thoughts, there's a question about, Dr. Rosenberg, how in the movie and in the book you really touch upon people of color with mental illness and how they're disproportionately targeted and even killed at alarmingly rates. What's your position on who should be responsible for addressing this issue? And that's a big question to answer in a few minutes. But
it is. Well, I think my quick answer is we all should be. We live in I think that was kind of the beauty of the Black Lives Matter movement. And as you know from my film, Black Lives Matter was originated for people with serious mental illness. It was founded by a woman who we ended up following in our film, whose brother has a serious mental illness. So, I think that it is something that we all need to be responsible for, and to deal with structural racism and to deal with this discrimination against people with serious mental illness and people of color. And when you put them together, you have a very volatile mix.
Jennifer, is there one thing that you'd like the audience take away from both the film or this discussion today?
I think mental health affects everybody, no matter who you are or whatever, and it's not going to go away. And I think it should be treated just like a physical illness. I think it should be treated along with a physical illness. It should be given the same attention as any physical illness, and nobody should be ashamed of it. I think, like everybody said, is like, you have a story to tell. People should be willing to listen.
Thank you. Thank you for telling your story. Dr. Gerber?
As difficult as it was to watch some of the things in that film, I actually left it feeling very hopeful. And I left feeling hopeful for a couple reasons. One was, I thought it wasn't, I haven't had a chance to ask Dr. Rosenberg about this, but I don't think it was accidental that one of the last stories he told was of that young woman. And at one point, as I was watching it with my wife, we paused it. And we happen to pause it right on this incredibly tender moment between that girl who you see in the ER and her mother. And you see, the love and the compassion, and you realize that people have just an extraordinary ability to heal. There are horrible illnesses in the world, and yet human beings are able to overcome them. And particularly when you intervene early and when you intervene with compassion and in a social system, you can make incredible changes. But the other thing I just feel extremely hopeful about is I feel hopeful that we can take complex issues and not polarize them. And that may sound strange as election day is just a week away, but I think we know that human beings polarize. But when you watch a film like Bedlam, I think you see the subtleties, right? There's no easy villain in that movie. You see individuals who on the one hand are in one mode may be violent and another are as gentle as lambs. You see professionals like these psychiatrists who may be part of a system that's broken, but who are enormously thoughtful and compassionate individuals. I still feel strongly about my identity as a psychiatrist because I get to go to work every day with people at Silver Hill who are just enormously generous and enormously caring of their patients, despite all the limitations in our system. So I think this is the amazing thing about human beings. They can get knocked down and then they get up again. And I think that when you can see a path and you understand what the challenges are, and you have a movie like this to talk about, I think things can be better. And we can look forward in 30 years to a different system. But we're only going to get there if we have these conversations and we make some tough changes.
And that's exactly why we wanted to bring this to you today. We wanted to start having a local dialogue with the Torrington community, and I want to thank you all for being a part of that. As Dr. Rosenberg wrote in the comments, please go to bedlamfilm.com, learn more, write a review on IMDb. I encourage you, if you haven't watched the film, it is available on PBS. The book goes into all of these issues in much more detail, so I encourage you to check that out as well. Again, I want to thank the library for co-hosting this with us. I want to thank all of you in attendance who took the time to watch the film this weekend and talk to us tonight. And most importantly, I want to thank Dr. Rosenberg, Dr. Gerber, and certainly Jennifer for being brave and sharing your stories with us. And we hope that this maybe will be the start of a series. So thank you all. I wish we weren't out of time because this is a great discussion. But yes, Jess just wrote the book will be available in the Torrington Library. So feel free to get it there as well. Thank you all and good evening.
Thanks so much.
Bye, everybody.